Hello, my name is Mario Castro, and this is my presentation on deep vein thrombosis. So, what is deep vein thrombosis? It is also known as DVT. Occurs when a blood clot, medically known as thrombus, forms in one or more of the deep veins in the body, usually in the legs. Deep vein thrombosis can cause leg pain or swelling, but can also occur with no symptoms at all. You can get DVT if you have certain medical conditions that may affect how your blood clots, um, and the way a blood clot form in your body could be if you don't move for a very long time. People that have surgery or have had an accident, they don't move, can develop these blood clots. Another example is if you're traveling for a very long distance or if you're on bed rest. It's a very serious issue because blood clots in the veins can break loose. They can travel through the body and potentially get stuck in areas where they don't need to be stuck, such as the lungs, possibly causing the blood flow to them. And that would be an example of a pulmonary embolism, although they have said that there's no uh, correlation exactly, that DVT is a direct causation to the issue. Some of the causes of DVT uh, have different risk factors that contribute to this issue. As mentioned before, surgery, for people that have like an accident and have had to get surgery, this is a big one, especially if it's surgery of the hip or the leg or even abdominal. If you've had some kind of trauma to the bone or had a fracture, that can also cause it. Um, we mentioned a long period of bed rest or sitting for a very long time. For individuals who have cancer, who are pregnant, um, for individuals that take birth control um, to help control menopause, and for people who have varicose veins. All these are causes of deep vein thrombosis. If we start looking here, um, if we look at our chart here, we start looking at the pathophysiology of this disease. Um, there are three mechanisms involved in DVT, um, which are damage to the vessel wall, blood flow turbulence, and hypercoagulability. Um, so the issue here is that the thrombosis, the blood clot, is a protective mechanism that prevents the loss of blood, and seals off those damaged blood vessels. Um, and here we can see that it becomes an issue because once we have all of these three things combined, uh, the blood clot or the thrombosis is what is how it's formed. The issue here, as stated before, is that once this thrombosis either becomes too big or something that can cause it to break away and start traveling, can become an issue, because then the health of the individual is at risk. So what are the symptoms? How can we identify DVT? Um, and unfortunately, about 50% of the time, it occurs without symptoms. But when they do occur, they may include swelling in one or both of the legs. The patient may feel pain. Their skin may feel warm. or there may be some discoloration, bluish or reddish of the skin. Um, it's always important to consider or to consult physician for diagnosis because um, there's other medical conditions that may present with similar symptoms, and just so we can be on the same page, be sure of what we're looking at. We always recommend looking at a physician or consulting a physician. Regarding treatment, there's a couple things that patients will resort to after talking to their physician. And so one of them is, as we can see here in this picture, compression stockings, which the main goal here is to prevent the clot from getting bigger. If there is a clot or when a clot forms, um, the idea is to prevent the clot from breaking loose and traveling to the lungs, um, and to reduce the chances of getting another DVT. So some of the treatments that are given are blood thinners, and unfortunately, the drugs don't break up existing blood clots, but they can prevent other clots from getting bigger, and they reduce the risk of developing more clots. Um, so it's typically treated with anticoagulants or blood thinners. These blood thinners can be taken by mouth, by injection, or through an IV. Um, heparin is given by IV. Um, and so what happens is that an option after taking blood thinners for a few days through an injection, the doctor may decide to switch it to a pill, which, to kind of give a different variation of the drug. The other treatment are clot busters. They're called thrombolytics. These drugs might be prescribed if you have a more serious type of DVT, um, or if some of the other medications are not working. Filters are the other ones. If medications cannot be taken to thin the blood, um, a filter might be placed in a large vein. And basically, I mean, it kind of explains itself, but it helps filter the blood or catch any potentially floating thrombosis that have that are floating in the blood, and keeps them from landing in the lungs. The next thing we're going to be looking here is the strategies. Uh, One of the things here that the Surgeon General has leaned into um, letting people know about DVT, and what are the things that one must do or be aware of. A program called CARE, which stands for Communication, Action, Research, Evaluation. In this first step, communication, the idea here is to raise consumers' awareness about DVT and the magnitude of the burden caused by these conditions. The goal is to educate consumers about the symptoms, risk factors, and these triggering events, especially when you end up having surgery, if you end up being hospitalized, and the effects of what happens when you don't move, or the complications that may arise, not necessarily from the surgery or what the person underwent, but because of, I stated before, things such as bed rest can cause such issues. The next phase is action. They want to form community coalitions to sponsor the public awareness campaigns by also developing um, develop tools and materials that patients can use when talking with their physician and other healthcare professionals. They seek to create local networks and peer support programs for patients and their family members. Um, so they want to actively try to be able to help these people because DVT is something very dangerous. If someone has um, has this issue, this medical condition, they really want to encourage the community to be able to be aware of what is going on. Lastly, the strategies in care. The R and the E stand for research and evaluation, and they look to gain a better understanding of what the public already knows about DVT. Try to identify the gaps in their understanding and how to best address those gaps, educate those people. Um, they look to develop and test messages to determine which approaches work best to educate the public, because what a medical professional may be able to describe in medical terms, um, maybe the majority of the community does not understand because they're not medical professionals. So they got to find a way to be able to translate what the medical profession knows into words that people that have not gone to medical school may be able to understand. They also look to evaluate the impact of communication and social marketing programs, including pre and post evaluation levels of consumer awareness and knowledge. And lastly, they look to conduct formative research to ensure that media messages are positive, realistic, relevant, consistent, and effective. They don't want to give any kind of false information to where if they figure out that 90% of people that have DVT are surviving, they don't want to find out, or they don't want to put out there that only 30% of those that have DVT are surviving. So they want to be able to give people accurate information regarding where they stand, what they could be done to help them out. These are my references. Thank you for everything. Thank you for listening. This is Deep Vein Thrombosis DVT by Mario Castro.